Hello, good afternoon to everyone. This is Melih Unver. First of all, I would like to thank to Mr. Emin Çakmak, Chairman, and then THTC's valuable team and everyone who contributed. We have got short teaser video of Fizyomer therapy, and then I will present presentation. And now first, let me start with teaser. Physiotherapy, physical therapy, and rehabilitation medical center is one of the most distinguished medical centers that implement an innovative and integrative treatment program in Turkey. Was founded in 2000 in Eskişehir, Turkey. Fizyomer therapy and physical therapy and rehabilitation medical center was founded by specialist Dr. Türkan Tüner. She has 35 years of professional experience as a senior specialist physiotherapy and rehabilitation. During the 21 years, she applies her own innovative and integrative rehabilitation program to the patients with cerebral palsy, stroke, spinal injuries, muscular disorders, and orthopedic disorders in Fizyomer Medical Center. Our mission: high quality rehabilitation for life quality of the all people. And our team: six physical therapy and rehabilitation specialist doctor, neurology specialist doctor, an internal medicine specialist doctor, radiologist doctor, dermatologist, 25 physiotherapists experienced one, 25 physiotherapy nurses, 4 medical masseurs, and in our medical units, 6 polyclinics of the physical therapy and rehabilitation, 2 adult neurological rehabilitation units, 1 pediatric rehabilitation unit, 1 orthopedic rehabilitation unit, hydrotherapy aquatic rehabilitation pools, wheelchair rehabilitation unit, robotic spinal decompression unit, lymphedema rehabilitation unit, physical therapy and rehabilitation, neurology, internal medicine, cosmetic dermatology clinic, thoracic, robotic laser unit, radiology, cryotherapy unit, occupational therapy, manual therapy unit, dry needling, acupuncture therapy, ozone therapy unit, and 80 physical therapy boxes are our medical units. What about our treatment modalities? Pediatric rehabilitation, adult neurologic rehabilitation, orthopedic rehabilitation, hydrotherapy, aquatic physiotherapy, wheelchair rehabilitation, occupational therapy, therapy, speech therapy, hippotherapy simulator, manual therapy, hand rehabilitation, shock wave therapy, ESWT, kinesiotherapy, PRP, plasma-rich platelet therapy, high-intensity robotic laser, magnetotherapy, dry needling, scoliosis rehabilitation, acupuncture therapy, spinal decompression therapy with robotic antalgic track is certificated from FDA, cryotherapy, cardiac rehabilitation, ozone therapies, pulmonary rehabilitation, post-COVID-19 rehabilitation, cosmetic dermatology, clinic applications, massage therapy. Pediatric therapy, we have got the 21 years experience on CP and myopathy and etc. And neurologic rehabilitation, experienced specialist doctors and physiotherapists are good at stroke and hemiplegia and neuroplegia and quadriplegia and etc. in neurologic rehabilitation. Nowadays, innovative treatment is we are usable in stroke and MS and Parkinson, virtual reality rehabilitation. Spinal decompression therapy. Our success rate is 95% with robotic antalgic track, certificated by FDA, is used by spinal decompression for herniated disc patients, cervical lumbar hernia. We are good at also sports rehabilitation and orthopedic rehabilitation, meniscus injuries, traumatic after accident, sport injuries like ACL. Hydrotherapy, aquatic physiotherapy is also effective on therapy on adult pediatric rehabilitation, neurologic disorders, scoliosis, kyphosis, CP, stroke, hernia, paraplegia, tetraplegia, and spinal cord injuries. Cryotherapy is effective treatment modalities in the pain and rheumatoid traffic accident injuries, sport injuries, tendon and meniscus laceration, and ACL. PRP, plasma-rich platelet, has got success about arthrosis, especially on knee. What does this laser do? High-intensity robotic laser do? Edema relief, nerve regeneration accelerator, facial paralysis, cervical lumbar spinal cord hernia, and also effective on sports rehabilitation. Rhinal effective on fibromyalgia. Obesity and painful syndromes are reach a solution with this therapy. What specialties in the Fizyomer Medical Center are the most demanded? Cerebral palsy rehabilitation, rehabilitation after stroke, rehabilitation after spinal cord injury, facial paralysis rehabilitation, rehabilitation after brain injury, orthopedic rehabilitation after hip bone and knee replacement, post-COVID-19 pulmonary rehabilitation, cardiac rehabilitation, spinal decompression therapy with robotic anti-tract after lumbar and cervical hernia. The diseases that we apply in successfully in pediatric rehabilitation: cerebral palsy, cerebral injuries after trauma, osteogenesis imperfecta, muscular dystrophy, neuromuscular disorders, and also successfully applied in adult neurologic rehabilitation: stroke, post-traumatic brain injuries, spinal cord injury, encephalitis, multiple sclerosis, neuromuscular disorders, cervical and lumbar disc hernias, facial paralysis. Pediatric and adult orthopedic rehabilitation: fractures, sport injuries, amputation and advanced prosthesis application, post-polio rehabilitation, post-operative rehabilitation, hip bone and knee replacement, arthritis, strains, back and neck pain, spinal conditions. Patient portfolio. Every year, 350 patients with cerebral palsy, stroke, spinal injury, and orthopedic disorders came to our center for Fizyomer's individual integrative rehabilitation programs from the several countries, such as Ukraine, Germany, Belgium, Holland, England, Kuwait, Lebanon, Finland, Uzbekistan, Kyrgyzstan, Turkmenistan, Kazakhstan, Azerbaijan, Algeria, Sudan, Iraq, Syria. This is the important note. We accept patients between the age 6 months and 90 years for treatment. What should I have to trust Fizyomer therapy? The reasons: 21 years experience on the pediatric rehabilitation for cerebral palsy, 21 years experience on adult neurologic rehabilitation, intensive and integrative rehabilitation programs, innovative treatment programs, high technology treatment modalities, 93% success rate of annually. We are offering to all patients 10 advances to international patients in Fizyomer Medical Center. First one, in addition to classical treatments, our individualized integrative rehabilitation programs that include innovative modalities such as virtual reality rehabilitation, robotic assisted rehabilitation, and aquatic exercise. The second one, intensive treatment programs are applied intensively to patients for 4 hours per day. Our treatments are very cost effective because of the patients are accommodated in 4 or 5-star hotels and residence suites near of the medical center. This provides higher accommodation comfort while providing a lower hospital stays cost for the patient and accompanies. 24-hour, 7-day medical assist, free transfer between hotel residents and medical center daily. We offer all patients and accompany free to only once during the treatment time. We are providing to all patients free airport VIP transfer by our reliable and friendly experts team, providing free translator support in Russian, German, English, and Arabic, Turkish cuisine and international meals. This last one is important. Eskişehir is the eighth safest city in the world. Location of the our city, 3.5 hours far from Istanbul New Airport, 2.5 hours far from Istanbul Sabiha Gökçen Airport, 2 hours from Ankara Esenboğa Airport. Our integrative rehabilitation programs accelerate the improvements of the patients with cerebral palsy and stroke. During the 21 years, it has been working with expert team in trial of the pediatric rehabilitation and neurologic rehabilitation. Intensive integrative rehabilitation programs that are developed by using innovative devices are successfully applied on the patients with cerebral palsy and stroke and spinal injury patients. Classical rehabilitation programs are usually consist of basic physical therapy applications such as electrotherapy, ultrasound, shockwave, and etc. Device plus rehabilitation exercises. In the classical rehabilitation programs, improvement of the neurologic disorders takes approximately 6 to 12 months. We are preparing 1 month intensive and integrative rehabilitation programs for the patient. Giving to the patient a total of 4 hours of the rehabilitation per day, 2 hours in the morning and 2 in the afternoon. After the patient neurologic exam, we add the innovative devices and methods to the treatment according to patient's neurologic condition. If the patient has spasticity, we add the cryotherapy or buttocks therapy to the program. If the patient has motor impairment or muscle weakness, we add the robotic laser therapy plus virtual reality rehabilitation and also aquatic rehabilitation to the treatment. If the patient has the balance and coordination impairment, we add the virtual reality rehabilitation plus robotic balance and walking therapy to the program. Our medical council creates an individual integrative treatment program for each patient. These programs are applied to the patient by expert physiotherapist team during the 1 month. Our comparative treatment results of our medical center in the last 2 years. Integrative programs are applied in total 153 cerebral palsy patients. Their age range is 6 months to 22 years old. After 1 month treatment, 30.7% of 52 patients who received classical rehabilitation programs had improvement in neurologic disorders. However, 75.2% of 101 patients who received our integrative rehabilitation program had improvement in neurologic disorders. In the same period, in total 250 stroke patients were applied to our integrative rehabilitation programs. Their age range is 32 to 78 years old. 46% of 63 stroke patients who received classical rehabilitation programs had improvement in neurologic disorders. However, 81.2% of the 187 stroke patients who received our integrative rehabilitation programs had improvement in neurologic disorders. As a result, we observed that our intensive and integrative rehabilitation programs that early applied on cerebral palsy and stroke patients speed up their improvement in the neurologic disorders. Finally, we want to say that our annual clinical success rate is 93 in all of the neurologic rehabilitation patients. And our other department of our Fizyomer therapy, the cosmetic dermatology clinic. These are the techniques we are applying: laser epilation, facelift technique, skin regeneration and rejuvenation, neck lift, wrinkle, acne and acne scar, wound scar, telangiectasia and pigmented lesion treatment. 3. Brow lift without surgery, body laser skin tightening, melasma, hyperhidrosis. Hair transplantation, follicular unit extraction have been used in technique for many years to achieve natural looking and lifelong results. Hair treatment with PRP. PRP procedure, the patient's own blood is drawn and treated in special instrument. The fraction that nurtures and develops the fibroblast is separated and injected into the area of hair loss. This method is particularly effective in genetic hair loss. Furthermore, the PRP treatment can be combined with hair mesotherapy in the patient with genetic hair loss. We wish the high quality life for the people all of the world. Thanks.